It's now Wednesday, the 27th of July, so it's just over 2 weeks until I go into surgery. And I've just gotten back this morning from my surgical pre-admission appointment. So I got called up to go in there at 8 o'clock this morning. It was meant to be this afternoon actually, but yesterday they called me and said that they didn't have an anaesthetist available for that list. So they asked me to come back. They asked me to come in at 8 a.m. this morning instead. So I had to get up a bit earlier than what I would normally like to do. I'm not really a morning person, but I went in there at 8 and they actually opened up the outpatient clinic for me because I was the first one there. So I thought, oh, great, I'll get through before the rush comes later on. I got seen pretty quickly, actually. The nurse saw me straight away and I thought, this is great. She did an ECG, full history. I went and sat down in the waiting room, and then a few minutes later I got called up to go in and speak to the pharmacist, and I thought, you beauty, this is great. We're going to get zipping through here really quickly. I spoke to the pharmacist. She asked me about my medications and we talked about certain things that I might need to stop pre-surgery. It's worthwhile mentioning at this point too, if any of you are coming up for surgery, to really make sure that you have a good chat to one of your doctors, anaesthetist, pharmacist about the different kinds of medications and supplements that can make a difference to your surgery, because I was on fish oil and turmeric to try and reduce inflammation and aches and pains after coming off MHT. But actually fish oil does thin the blood, so you should definitely come off that a few weeks before your surgery and maybe just check with the pharmacist about other supplements and things that might interfere with the medications or make your blood clot too much or bleed too much or something like that. So there's lots and lots of interactions of things that, we may not even think about with our supplements and stuff that we take. So that's definitely worthwhile exercise, going through all your medications and supplements before you go into surgery. So I had that chat. That was great. Went and sat back down in the waiting room again. And probably a half an hour later, the breast care nurse called me in to have a chat, which I wasn't really expecting because I'd seen the breast care nurses already. But she was lovely, and she said, oh, actually our anaesthetist's been called away to do a cesarean this morning, so you might be in for a bit longer yet. And she wasn't wrong too. I sat in the waiting room listening to podcasts and things like that for another 2 hours before I got seen by the anaesthetist. So all in all, it was a 3-hour exercise, but I'm just glad to get that over with. One of the minor little hiccups in my situation is that I have a Mirena IUD. And I'm on my third one now, actually, which has been absolutely fantastic. It's been great contraception over the years. It's kept my bleeding non-existent, and it's also a really good option for women who are using MHT because it thins and stabilises the lining of the uterus and it balances out the effects of the estrogen in the uterus. So I used it as part of my combined MHT. But of course, now that I have a cancer that's progesterone positive, progesterone receptor positive, it has to come out. So I went to my GP to have it out, but unfortunately it's decided it really is very happy in there, thanks very much, and is hanging on for grim life. And despite my GP hauling on the string and breaking one of them, it didn't come out. So whilst I'm going into surgery anyway, we're trying to organise for a surgical registrar to take the Mirena out under anaesthetic, save me going back for a second anaesthetic potentially later, which makes a lot of sense. So that's another fly in the ointment, really, to try and coordinate. On top of that, throw in COVID. I'm already noticing big time in the hospital system at the moment how that impact is directly affecting services. So it's kind of daunting, it's one thing to be going in to surgery to have your boob off and have to kind of deal with all of the breast cancer-y stuff, but also knowing that you're going into a broken hospital system and that they're going to scratch together whatever surgical team they can on the day for your life-saving surgery is a little bit daunting as well. So I just have to keep reminding myself to be grateful that we've got this amazing system that we do that makes sure that everyone gets the treatment they need. And as a Category 1 patient, this is definitely a non-elective surgery and will get priority. So I'm very, very grateful for that and really, really hoping like hell that myself and my surgeon don't get COVID between now and then, because I think those are the two things that will really throw a spanner in the works and cause a delay.